Hello, my name is Lee Gibbs, and today we will discuss one of the many diagnostic assays that are used routinely in the clinic, which is called an ELISA. An ELISA is an acronym for Enzyme Linked Immunosorbent Assay. This assay has the potential to diagnose diseases such as hepatitis B, HIV, and even malaria. This assay actually can be used for any disease that has a distinct immune response that has specific molecules that are released in the bloodstream that can be quantitated for measurement for the for the diagnosis of this disease or to monitor the progression of this disease. Actually, the ELISA has transcended as it's been modified to actually be a household pregnancy test. So the household pregnancy test that you can pick up at CVS or Walgreens that utilizes urine to act for screening for pregnancy actually looks for a specific molecule, which is a hormone that is released during early stage pregnancy. So if you ever been married to a woman that's had a child or have been pregnant or have given birth, and you've used one of these tests previously to find out the soon joy that you was bringing into this world, you actually use an ELISA. You use science. So we're going to give a brief overview of the protocol of an ELISA, actually how it works, and actually go through a physical, a typical example of what is used of what is done in the everyday clinic to actually assess the diagnosis of someone's disease. So I think it's best if we try to wrap all those aims into one potential experiment, one potential setting that we can put this experiment in. So let's just say, for example, we work in a laboratory in a hospital, and there are some patients' serum, blood serum, that is sent to us. Maybe it's blood or plasma, and we have to diagnose by using an ELISA, which stands for Enzyme Linked Immunosorbent Assay, if they actually have this disease. Let's say that we're looking at malaria. So we're looking for a specific molecule. So the benefit of what we can use in our lab is what's called a sandwich ELISA. A sandwich ELISA has extreme sensitivity, and its extreme sensitivity is based off of its ability to use what's called antibodies, and antibodies are just these little molecules that actually bind to, they have binding specificity, and they bind to certain proteins or other molecules in your body to be removed by other immune cells. But what they're using the antibodies for is for their properties to bind specifically to a certain molecule. And our antibodies will be designed to bind specifically to whatever molecule that is told to us is going to be released or going to be used for diagnosis of this specific disease, which is malaria. So we decide that we're going to run this assay. We have our antibodies. What else do we need? Well, it's right in the word enzyme, enzyme linked. So an enzyme is actually a molecule that when another molecule acts upon it that actually binds specifically to that molecule, it causes a reaction. And as we know, as I spoke about earlier about this assay, is that we're going to read out how much of these distinct molecules are actually in this patient's sample, in this patient's blood. So therefore, we have to have a way to read that out. So an enzyme, and when it binds to its another molecule, which is called a substrate, is actually going to cause a color change if this enzyme that is going to be bound to this, that is going to reside in this well, actually gives a colorimetric response, meaning that it changes colors. We'll have a machine that's going to read out this information. So how do we set this up? Well, one way that the main thing that you start with to set this up is that you're going to first have your capture antibody, which is going to capture your actual molecule that you're going to look at, is going to be put on the wells on the plate first. Then we're going to add our patient samples to each well. And normally we do that in duplicate or triplicate fashion to make sure that we are not seeing something once and then it just goes away. We want to make sure that we have triplicates so we can verify what we saw in that first well. Then after we put our samples in there, it's going to, if the molecule is there, it's going to pull down this molecule, bind it to it at the bottom of the plate. Then we'll have another antibody that is specific for our molecule, and it's actually going to bind on top, or it's going to bind to that other molecule, and basically, as it sounds, make a sandwich this way. So you have this antibody, which is here, this antibody, which is there. They're actually going to sandwich this molecule. And the beautiful thing about this second antibody that's on top is going to be used as a detection antibody to detect our molecule. And what's going to have that enzyme that we talked about. And when we add this substrate to the enzyme, it's going to tell us how the intensity, how many molecules of this from this disease do we actually have. So what it's going to do is give us a readout, a number, a measurement. The more antibodies that are secondary or detection antibodies that are binding to this molecule, the more enzyme that we'll have. So when we add the substrate, the more the intensity of the colorimetric change will be higher, and that will give us a higher readout of what we actually have in that well. So for example, we have patient A. Let's just say that we look and see the colorimetric change is a light color versus another patient is an extreme dark color, and we get a measurement for that light color, which we'll say is 10, for this dark color is 100, and we have a sheet that tells us that a patient's molecule level is past 50, this person has malaria, where the patient that has the measurement of 10 will not actually have malaria. The patient that has 100 will probably have a lengthy stay at the hospital. So that's how an ELISA is used in a clinical setting, and that's actually how it has the potential to be used for diagnosis of many diseases, but for what it has been used for, main three is hepatitis B, HIV, and malaria. So thank you for your attention, and if you have any questions, please email me or contact me by the information that's linked at the bottom of this video. Thank you.